Hi guys, how you guys doing? So I kind of just wanted to come out here and just pretty much do a really quick video for you guys, and today's video is going to be about central venous pressure and CVP monitoring. So if you're not familiar with what a CVP monitoring is, maybe you're a brand new nurse and you're just starting off your career in critical care, congratulations. Or you're just a brand new nurse, you're graduating and you definitely have an interest in critical care, this video is for you. So we're just gonna go over quickly what a CVP monitoring device is and the different usage of it. So what do we use a CVP monitoring device for? In my practice, most of the patients that would be in a CVP monitoring device will be patients, maybe they just had a big surgery, patients that just came from the OR, they had a lot of fluid loss or a lot of blood loss, whatever the case is. They will need to be on a CVP monitoring device just to kind of help us to replenish their fluids and get them back to being hemodynamically stable. Other patients, definitely I would say the patients that I see in my practice as a SICU nurse, surgical ICU, is patients that have maybe they had like a renal transplant and they kind of, we need to give them large amounts of fluids just to keep that kidney perfused. Then we will definitely attach them to a CVP monitoring just to kind of see exactly where we're at and whether we need to give them more fluids or not, because these patients definitely we need to watch their intake and output, and we need to make sure that they do not have less fluids than more, because if these patients have a low blood pressure or they have less fluids in their body, then that's obviously going to affect the perfusion of the kidneys, and that is no good for a person that just got a brand new kidney. We want to keep it perfused and we want to keep it working. Different patients that may have CVP monitoring device, I will say maybe a patient that is very septic. This patient they need a lot of fluids, or maybe it's a patient that maybe they're having CHF exacerbation and they are very overloaded. These patients will also need to be on CVP monitoring device too, because, well, not that they need to, sometimes that they will attach them to it just to kind of help us see exactly where they're at, and maybe we need to give them more Lasix or not or whatsoever, then these patients will be attached to it as well. So different things can definitely affect your CVP monitoring. That includes your blood pressure, that includes your stroke volume, that includes your heart rate, and of course different things, maybe your intrathoracic pressure, your abdominal pressure, that could also affect the CVP monitoring reading. And they always say like maybe it's not like 100% the most accurate, because different things can alternate your reading and what you're seeing, but it's still a pretty good indicator. Maybe these patients, the physician will just have the patient on the flow track, which could give us more accurate number, because it definitely takes the stroke volume and the patient's cardiac output into consideration. Nowadays, we actually have some non-invasive flow track measures, so that can definitely maybe be like an option for that patient. But let's just focus on CVP monitoring device. Normal pressure is between 8 to 12. So what does that mean if a patient has a higher pressure or lower pressure? So a patient comes in, maybe they have a CVP reading, maybe it's like 20, 25, it's a lot higher. Of course, different physicians have different numbers that they want to use. Maybe they're okay with the CVP that's slightly a little higher. Maybe that's okay for that patient and they're not gonna give more interventions. Or maybe it's a little bit lower and they're kind of okay with that too. So always check with your physician of where they want to keep the CVP pressure at. Then you can understand exactly when you need to intervene or not. So patient has a high CVP reading, it's probably a patient that is very overloaded, and this patient is going to need maybe some Lasix. And if they're not able to have Lasix for some reason, maybe they have kidney failure and they're not able to excrete urine, because remember, Lasix is a diuretic and they have to be able to pee it out. So maybe this patient is going to need dialysis or whatever the intervention is. They're definitely going to need something different. And the contrary, for a patient that has a very low CVP monitoring pressure, it's probably someone that's very dehydrated and they're gonna need some more fluids. Maybe that patient is very septic and we're giving them large amounts of fluids. Then it kind of gives us a good indicator of when we need to stop or not, because we need to give them more fluids. So yeah, that's pretty much with the CVP monitoring. Like I said, remember, higher than 12, probably patient is overloaded, and if they have a very low pressure, then that's probably mean they're dehydrated and they need some more fluids. One thing that I am going to note is that well, before I move on to that, if a patient cannot have fluids, because not everyone is able to have fluids, maybe they have some secondary diagnosis or different things that could affect them from getting fluids. Maybe albumin can be another option for that patient that needs some replacements, or whatever the decision may be. But definitely check with your physician and try to see exactly what they want to order. So with that, and also with the CVP monitoring, one thing that I definitely wanted to note is that since it is measuring pretty much the right atrium preload for the most part of what's going on in the right atrium, they will need to have a CVC catheter, central venous catheter. If you are not familiar with the central venous catheter, it is a catheter that we could either insert in the jugular vein. It definitely goes in a bigger vein, or maybe it could go in the chest wall cavity right here that they normally insert it. Maybe they need to have it inserted into the groin area, and it's a longer catheter which is going to go into the larger vein closer to the patient's heart. And that's why a CVC is needed, because it's a longer catheter and it's able to go closer to the patient's heart, and we're able to kind of get a good pressure from there. There's been little research here and there about whether whether a PICC line could be, really good for CVP reading. But for the most part, the CVC is definitely the gold standard, and that's what they want us to be using. At least in most facilities, that's what we use. So yeah, that's with CVC pressure. And definitely, if you've never put on a CVC catheter, just if you're not going to be doing it, is definitely the physician or the nurse practitioner or the PA that's going to be inserting it, as opposed to maybe you're familiar with a PICC line nurse that can come in and put a PICC line. They're definitely not going to be putting in CVCs. That's physician that's going to come and do that. Just get familiar with your hospital policy and exactly what you need. It's definitely a sterile procedure that you're going to have to make sure that all the things that are needed are there. Some facilities actually have central cards. They have line cards that pretty much already has everything in there, everything for the physician or the practitioner to drape into, and just to prepare the sterile fill. But definitely get familiar with what your facility uses and where those equipments are, so you could be ready for them to insert that. So yeah, that's basically all that I have for you guys for today. And if you have any questions for me, definitely reach out. Don't be afraid. I have my messages that I check all the time, and I love to hear from you guys. All right, I love you, and I hope you guys are having a great day. Bye.